Could I ask an understanding around the table, because I've got some confusion with data in terms of, I'm always getting a bit depressed hearing relapse, relapse, relapse. I'd like to know what everybody's thoughts are on the figures for not relapsing, because there seems a bit of confusion between COG data and SEOP and the European and so on data. So I struggle with what seems to be all this talk of relapse. Is it not a case that our children that do clear the disease will go through the immunotherapy and stay clear 85 after 2 years, stay clear after 2 years anyway? That data is SIOPEN data that we've been quoted by our consultant, but that's also been given to us from the COG data. But speaking to some people, I don't think that data is correct for COG.
So for COG, the latest that I've seen is that with antibody therapy after stem cell transplant and aggressive chemotherapy and then immunotherapy with cisretinoic acid, that the 2-year event-free survival is in the 60 to 65%. But much of the data looks like 5-year. So what we know, 5 years is not all of those patients had immunotherapy. That 5-year event-free survival for high-risk neuroblastoma, which is stage 4 neuroblastoma over the age of 18 months at diagnosis, is about 50%. You'll see data quoted in studies anywhere from 40 to 60%. But it looked like adding antibody therapy, improved that 50 to 60-some%, and now we're watching those children to see, do they stay in remission, longer term. So 85% would be much more accurate if your child was under 18 months. So age is a very important.
85% at 2 years or 5 years, 2 years.
Well, even higher than that, to be honest.
She was saying that differs depend on what age they were diagnosed.
Yeah.
Yeah. I thought we were just talking stage 4.
Stage 4, even young babies with stage 4 and toddlers with stage 4, less than 18 months, have a significantly higher outcome. So some of it is how you look at that, those percentages.
Another, just slightly twist what we've just said, and it's quite relevant to our personal situation. We've seen so many children where they've presented symptoms for 3, 4, 5 months before they've actually had the correct diagnosis. It's always going to be very difficult to quantify when that neuroblastoma was there. But clearly, you're going to go, some children are going to go through that 18-month point. To explain that completely, Anya first, in hindsight, presented symptoms at 17 months, but we spent 6, 7, 8 weeks being told it was something else. So actual diagnosis, we were 19 months. So you can understand my mind is so screwed up with.
Yeah,
we're under 18, yeah. Or no, we're not. Yeah. How do you quantify that?
So, if I were your oncologist, I would tell you, neither you nor I know if she's going to relapse. And so I would, as you already probably are doing, treasure every day and expect her to grow up. And if you make her a princess, you have to live with her. Because, yeah.
I've done that before.
Well, that's fine because you get to live with her. But, princesses sometimes are a little challenging as teenagers. So I would expect her and look forward to her being a teenager and to walking her down the aisle. And I think you have every right to look forward to that. And neither you nor I nor anyone else can tell you, is she going to relapse?
No, but the data statistics that we were talking about, they tell us 18 months seems to be a pinch point.
Yeah, there's nothing magic about that. I mean, it's a continuum. So, if she were 12 months, it would be an easier answer. But The truth is, I don't know.
So
but I would be a little more optimistic than if she were, 8 or 10.
7 or 8.
Yeah, I understand, completely. I'm trying to grasp how the data relates to, was the neuroblastoma there when she was 12 months old, but we didn't realise it until she was 19 months old, or
it was probably there before.
was it there the day that she presented the symptoms at 17 months old? And how does it explain that? Is it on diagnosis or is it on neuroblastoma being present, the significance of the age?
So most of the studies quote the data based on when it was diagnosed, meaning when it was biopsied. However, I would still come back to, so she's in remission.
Yeah.
Um,
We're still waiting for the end of treatment scans in a couple of weeks, but we've been in remission since July before she went into transplant.
so
I don't want to personalise this, I'm really sorry.
Yeah, no,
I'm not
it's okay.
looking for a personal diagnosis, I'm just trying to grasp the understanding of figures and diagnosis, and it was getting really depressive, all this relapse.
yes,
Where I was going as well, if the figures that we've just discussed in terms of event-free survival were correct, and 50, 60, 70%, I can't quite then understand how we can have relapse rates. Again, that I've seen quoted, neuroblastoma relapse in high risk is going to be anything between 50 and 80% chance of relapse. Never know what figures to believe.
well, it depends on what year you pick. So if you go to the year 2000, it was close to 80%. If you go to 2014, well, we don't know yet, but it's probably closer to 40 or 50%. So some of it, a lot of these trials will look at a 8-year trial. And is it definitely getting better? It's definitely getting better. But for any of you, when you personalize it on your child, the answer is we don't know. And then, as much as you're capable of treasuring every day, and looking towards the future, I think you have every right to.
Do both. Do both, because you have a different perspective than parents whose children never had cancer.
Yeah, I'm going to end up with 30 people counselling me in a minute. Believe me, it's a struggle to let go of that fear and to start living your life again.
So I don't mean to do anecdotes, but I had a patient a number of years ago whose mom was as anxious and neurotic as I am. So pretty anxious. Had a lot of fear about relapse, and her child had high-risk neuroblastoma at age 4, and it was prior to antibody being available, and it wasn't available at the time he finished stem cell transplant. So he got aggressive therapy, but not antibody, or he got Accutane. And at some point, he was out 5 years and free of disease. And I said, okay, now you can worry about his driving. Because she needed to worry about something. So now you can worry about his driving, but I think we should quit worrying about neuroblastoma. So she called me on his 16th birthday when he got his driver's license and said, okay, now I'm worried about his driving. He graduates this spring from college as an engineer. And I think those are stories you also need to hear.
Yeah.
And those are true stories. So regardless what percentage we tell you, you're coming to a meeting where most people have dealt with relapse. But you should also encounter those families' stories as well. And I think those are genuine stories as well.
You'll never stop worrying.
No, you
Never.
won't. I think
So you'll start worrying about her driving and
Yeah,
her
there you
dating too.
maybe to put it in perspective a little bit, it's always good to be prepared for the what if. I think anything that makes you a little bit more prepared for the what if is a good thing. And I can share from our story, we went to a neuroblastoma concert in July of 2008, and our son relapsed in August of 2008. But the thing about that was we had almost the roadmap that Pat's talking about doesn't really exist, because we had heard so many things. We had already in our heads kind of, all right, if this happens, I have a decent idea of at least what to look at. Maybe I don't know what to do all the way yet, but I know where to look and what to look at. And so hopefully we've given you that, if nothing else, and maybe even a few neuroses that you didn't come here with.
Yeah, the last 2 days have opened my eyes more, and they were fairly wide open anyway in terms of options and so forth, but an MTRC and so on. There's a viable option there now that we didn't know about. What some of us have experienced with consultants that, we don't know what to do next, and it's hard to accept, but we know that does exist.